Hi there, I'm Dr. Gall.
Hi there, hi there.
And what's your name, please?
Richard Stevenson,
And your date of birth?
29th of the 48.
Okay. Can you tell me a little bit about why you're here today?
Well, I've had this very bad cough the last few months, so I'm a bit worried about that.
Okay, do you want to describe the cough a little bit for me?
Yeah, well, as I said, it's been getting worse for the last 3 months, and I've been very, very short of breath. And the things that worries me the most is there's a wee bit of blood in my cough.
Mom! It's been a couple of months you've had this cough for now. Can you think of anything that might have triggered it off?
Well, it has coincided with me coming back from a holiday in India.
Oh, it's good to be home, Barbs.
Hi, Richard. I'd like to get the pictures of the Taj Mahal developed.
And have there been any other symptoms that have been bothering you?
Well, now that you mention it,
Richard, why have you not been eating your dinner?
Oh, I've not been hungry lately, Barbs. I've been feeling really tired. I'm not very hungry.
Richard!
Look, what is it, Barbs?
You're dripping all over me!
Doc, not again.
In any consultation with a patient, it's important to cover all the basics. Things such as past medical history, drug history, allergy, family history and social history all need to be covered, as well as a systemic review. In this case, there are plenty of red flags that are showing up in the moment. Here's a bit about what I'm thinking.
In the first part of the video, we have taken a look at the clinical side and some of the classic red flags associated with TB. Now we're going to look at the science behind the cough and the drug treatment involved in TB. As you can see, the cough associated with TB is an involuntary reflex involving receptors in the cough center located within the medulla. The cough itself begins with a deep breath in using the diaphragm, which is controlled by the phrenic nerves. Following this is the contraction of the anterolateral abdominal muscles beneath the closed vocal cords. The vocal cords then open through the control of the vagus nerves, releasing a stream of air which results in the eventual cough. We are now going to take a look at the investigations used to diagnose TB. Once infected with the Mycobacterium, the disease can be active or can remain latent for some time. In the case of the active form of the disease, shown in the video by Mr. Stevenson, we would take a sputum sample and use a Ziehl-Neelsen stain to check for the presence of Mycobacterium. We would also want to do a chest x-ray in order to rule out other diagnoses and for lymphadenopathy. As mentioned, TB can remain latent for some time after infection. It can be reactivated to become an active strain of the disease. This can be caused by decreased T-cell function in cases of patients who are immunocompromised or immunosuppressed. To diagnose the latent form of TB, a tuberculin test or a gamma interferon test are used. The gamma interferon test is more specific and requires fewer visits, but needs to be carried out in a lab environment and is much more expensive. We are now going to talk about the management of TB. First of all, it is important to test for HIV, as it is a major risk factor in developing TB. It is also vital to remember that TB is a notifiable disease, and public health needs to be made aware. The drug treatment for TB is as follows. Start off with a 4-month course of the right drugs seen on screen, followed by a 2-month course of rifampicin and isoniazid. Finally, it is important to notify the patient of the side effects of these drugs in order to ensure high patient compliance and to prevent the development of multi-drug resistant tuberculosis.
Hi there, I'm Dr. Gall.
Oh, I'm Richard. Richard.
I just shared a date of birth.
Sorry, I'm fine.